My name is Salman Khan. I am actually a pulmonary critical care physician here at Mercy Medical Center. Part of what we do is help out with the pulmonary service as well as the critical care service as well. More importantly, we are quite involved with the Lung Cancer Institute here, and from the get-go, from the diagnosis to a point where patients are enrolled in treatment programs, things like that, we assist our other colleagues, including thoracic surgery, hematology, oncology, and radiation oncology, and most importantly, our staff from the Lung Cancer Institute itself. About 20 years ago or so, lung cancer had a different meaning to it. We didn't have as many treatment options. We didn't have as many surgical options, and we've come a long way. But what's the most important thing is, in the diagnosis of any cancer, most importantly lung cancer, is time. Timing is of the essence. The earlier we diagnose, the better off we are in terms of prognosis. Oftentimes, if it's early enough, it could be curable, and patients tend to do very well over a period of time. The ideology behind doing lung cancer screening is to catch abnormalities, whether they are nodules or spots which are concerning on the lungs. If they're caught well in time, more things can be done about that. Usually, for lung cancer, 9 out of 10 times, if you're having symptoms as a patient, it's probably a little too late in terms of prognosis. Treatment options are available, but the prognosis becomes more poor. So the idea of cancer screening is to pick up on those abnormalities early enough so things in terms of management can be done about that, and we can be ideally free of cancer, or at least in a better stage. To answer your question, low-dose CAT scan, which is commonly abbreviated as LDCT, it's a simple tool to pick up on some of these things, and involves a criteria, and it's a very simple criteria. Usually folks, men or women, at the age of 55 to 77, who have smoked a pack a day for 30 years, which becomes 30-pack years, or 2 packs a day for 15 years, also equals 30-pack years. Still smoking or quit within the last 15 years. Those are the 3 criteria. And as long as they meet those criteria, they're eligible to get a low-dose CAT scan. And the other part of that is the reason we call it low dose as opposed to a streamlined standard CAT scan is the amount of radiation exposure. So the idea is not to continue to expose higher amounts of radiation. This is the least amount of radiation, which is basically picking up on things early enough. And that helps. And it goes back to the same thing, is the earlier we find out. If here at Mercy, we have a wonderful program. We have a lung nurse navigator who follows these CAT scans. For example, if I order a CAT scan, or a primary care physician orders a CAT scan, abnormalities or no abnormalities, the patient is already on the radar for the navigators, and they follow those in terms of time frames. For example, if there's a nodule which needs to be followed up in 3 months as opposed to 6 months, they would know about that, and they actually work a nice tool as a reminder to the patient, most importantly, because also the physicians, whether they're the specialists or the primary care doctor. Once we have a abnormality, the navigator, the lung navigator we have here, they're exceptional in terms of notifying the correct physicians, of course involving the patient. So if a patient needs to be followed up with a pulmonologist as soon as possible, they're extremely good with that. My office receives a call or email right away, and the patient is typically seen within a week after that. Subsequent to that, depending on the nature of abnormality we're dealing with, a appropriate testing is performed, whether it involves biopsy, whether it involves referral to a thoracic surgeon. That decision is also made oftentimes in the lung care conference, where we have a multidisciplinary approach. So we may have a difference of opinion. For example, I may suggest a lung biopsy, and a thoracic surgeon might defer. And what happens is when we all come together with 4 different specialties: thoracic surgery, medical oncology, radiation oncology, and pulmonary medicine, we can come up with a reasonable solution, the best possible solution for the patient to move on forward with. The other aspect of that is a one-call referral system. So once they actually get referred to that, the part of work or the amount of work on the primary care doctor's side can be eased for them. They could be referred to various specialties, whether they need to go to radiation oncology or oncology or pulmonary. All could be done, and that could be the center of getting all the information in. And this is all done while primary care physicians are aware of what's going on with their patient. They don't lose their touch, except their work is easier, that we're taking care of it for them. So it's a wonderful mechanism which works very nicely. The lung navigators, to be honest with you, they do a fantastic job. I mean, they're picking up on, once the CAT scan is read by a radiologist, there is a RAD score, which is essentially what it means is what needs to be done about this CAT scan. Do they need immediate attention or repeat scan in 3 months, 6 months, a year, or not? And sometimes even before the ordering physician gets the results of it, or interprets that results, I think the navigator is already on the case, and they pick up on it and they follow it, and that really keeps things together. And I'll be honest with you, there are times where you're looking at a CAT scan and you want to get to it, but if you have a person essentially working for you and letting you know this is what we need to do, it becomes easier for physicians as well. So the team approach to that actually works very nicely, and I think that really sets Mercy apart when it comes to that. Is before even the patients are even registered with our program, once they have those low-dose CAT scans which have shown things, they are picked up by the system and they're being followed, whether an official referral has arrived or not. And I think that really sets it apart. We take pride in the quality of care we provide. We practice above and beyond the national metrics and guidelines. In terms of standard of care, we have all the technology and expertise available right here in your backyard in Canton, Ohio. In terms of accessing certain procedures, accessing tumors, nodules, we have those capabilities. We have that expertise in terms of physicians. And when it comes to treatment, we have access to, in terms of chemotherapy, access to clinical trials, which are offered anywhere else throughout the nation, and larger academic centers. We have the same access. Our oncologists are very plugged into those programs. So the essence is the quality of care, the standard of care is available right here. And unless there is a reason, patients don't have to travel long distances to larger academic institutions to get the same level of care and same type of care. I would say the most important thing is to start the process early. If you meet the criteria for low-dose CAT scan or lung screening CAT scans, get them scheduled, get them done, and make sure that we don't have any abnormalities. And God forbid if we do, when we get to react on them quickly. We want to be ahead of the game as opposed to behind. So as a physician, 4 words mean a lot to me. It makes me proud. It makes me excited to come to work every day. It makes me want to be part of this team, which has helped us achieve this award. However, most importantly, this award is for you, the patients.